I'm Dr. Jonah Murdock, and I'm a urologist and urologic surgeon specializing in robotic and laparoscopic surgery. This video is for informational purposes. For diagnosis and treatment, any individual should seek a professional caregiver. This video concerns the relationship between metabolic syndrome, erectile dysfunction, and low testosterone, or hypogonadism. Approximately 20% of men in the United States have metabolic syndrome, which consists of a insulin dysregulation, that is a high fasting blood sugar that is not quite diabetic, borderline high blood pressure, central truncal obesity, that is obesity around the waistline, and abnormal lipids, or a high, which consists of a low HDL. This 20% of the American male population which has metabolic syndrome tends to have a higher incidence of erectile dysfunction as well as a higher incidence of hypogonadism, or low testosterone. What is the relationship between low testosterone, erectile dysfunction, and metabolic syndrome? It is not exactly known what the relationship is causally, but we know that those individuals that have metabolic syndrome are at much higher risk for low testosterone and its effects than the general population. In addition, patients who have erectile dysfunction are at higher risk for metabolic syndrome. So it seems that somewhere deep inside the body there actually is a causal relationship between this constellation of symptoms which constitute metabolic syndrome and erection difficulties. In many individuals who have metabolic syndrome, if you test their testosterone levels and it is either very low or borderline low, and if you give them testosterone replacement therapy, frequently their metabolic syndrome improves. That is, their percent body fat tends to decrease, their truncal obesity tends to decrease, and their erection function can improve as well. Some people have postulated that the treatment of metabolic syndrome with testosterone replacement therapy can help to improve its symptoms in addition to the usual treatments, which include weight loss, exercise, control of high blood pressure, and control of blood sugar levels. Generally speaking, an individual who has metabolic syndrome and who also has erectile dysfunction should be screened for low testosterone levels, because replacement of these levels may be of benefit to this patient.